my channel. So today I wanted to show you some apps that I use as a nurse practitioner while working in the clinical setting. So stay tuned. The first app I want to talk about is the 5-minute clinical consult. This app has a lot of helpful resources within the app. As you can see here, they have algorithms that you can click on for a certain diagnosis or chief complaints. They kind of lets you know how to treat or how to work up that patient that's in your clinical setting. So for example, if you click on medications, you can click on the medication that you're interested in. It'll give you information on certain diagnoses that you can prescribe that medication for, and so much more. It will also give you information about the diagnosis you're looking into. There's information about like the vaccine schedule for children and adults, so you don't have to go to the CDC website. It's literally located right here on the app. So I wanted to give one more example. So say you are trying to figure out how to treat sinusitis. You literally could just type in sinusitis. It's going to give you information about the diagnosis, how to diagnose it, how to treat it. So like I said, this app is very helpful to use while working as a nurse practitioner or provider. The next app is called Visit Coding. This is a great app to help you determine how to charge and code for a visit. Unfortunately, this app is only available for iPhones, but is very, very easy to use. You simply fill out the information that it's asking about the visit that you saw, and at the bottom of the screen, it'll let you know how to code that visit. So is it a 99203, 99214? It's a great resource to use until you get comfortable coding your own visits. This app is free, and like I said, it's only available for iPhone, but it is great to use whether you work primary care or urgent care or any specialty. The next app is EMRA, Antibiotic Guide. Hopefully I'm saying that right. But this app is all things antibiotics. So if you have a question about a certain body system and you want to know which antibiotic or what other second line treatments for whatever diagnosis or chief complaint that you have, this is a great app. Two other helpful apps that are similar are Sanford and Pharmacopoeia that I won't be showing in this video. The next app is called PDStat. This is a great app if you work with the pediatric population in an urgent care, emergency room, or critical care setting. This app provides vital signs, reference ranges, and dosing calculations for acute and emergent situations that might pop up while working with the pediatric population. Once again, this app works best for if you work in an acute or urgent care or critical care setting. So once again, this app might not be as helpful if you work in primary care. The next app is Apocrities. This is probably my favorite app. I reference this app almost every day while I'm at work. There's a free and a paid version of this app, and I highly recommend to get the paid version. The app is so easy to use. You can type in whatever you're looking for and information as far as history and exam, tests to run, treatment options, all that is available on this app. This app doesn't require as much reading as UpToDate might, so it's very good to use if you're just trying to quickly glance over to see what you need to do for a certain chief complaint or diagnosis. Apocrities has different guidelines, references. It has a drug interaction checker. It also has a nice feature where you can check to see if a medication is safe to use during pregnancy or while a mother is breastfeeding. GoodRx is also in Apocrities, so if you're trying to look up to see how much a medication may be for a patient that doesn't have insurance, it's also available. And I'm showing you the paid version of this app. The next app is Sublux. This app is great to use if you have to order and interpret x-rays. This app will show you how a normal x-ray will look, and as well as certain diagnoses, how those look, to help with interpreting. I'm not 100% sure, but I think this app might only be available on Android now. I know it used to be available on the iPhone, but when I was searching the Apple Store, I could not find it. But if it is available, I would definitely recommend to download it. The next app is UpToDate. UpToDate provides a lot of information about whatever topic you're inquiring about. It can be expensive, but the good thing is a lot of employers will provide this resource for free, and it does allow you to get CMEs as you search for different topics. Like I mentioned earlier, it does provide a lot more information than Apocrities, for example. So some people prefer this because it's a lot more thorough, and some people don't because they kind of want to be able to just glance and figure out what they need to do. So it's just kind of more personal preference on using this app versus some of the other apps that I showed. But once again, this is a really good app to have for backup if you are trying to find more information about a certain disease or diagnosis. Family Practice Notebook is also another great app to use. BlackMed is a great resource and app to use to help you figure out which medications are safe to prescribe a mother that is breastfeeding. It also gives you information on some of the side effects the infant might develop while the mother is taking that medication. Orthoflow is a great app to use for the management and treatment of fractures. The app is very easy to use. It gives you information on x-rays to order, how to classify the injury, and also how to treat and manage the fracture. This app is only $5, so I definitely think it's worth it if you deal with the management of fractures in urgent care or primary care. The next app that I wanted to talk about is actually two separate apps, but I kind of put them together. It's the CDC STI and Vaccine Guidelines. Both of these apps are free, and they're a great resource to use for treatment of STDs and as well as the schedule for vaccines for adults and children. The next app is MDCalc. MDCalc is a reference that provides evidence-based tools and calculators to assist in clinical decision making. So for example, if you're trying to see if your patient is at high risk for developing a DVT, you'll find the reference that you can use to calculate that, fill out the information, and it will provide you with the result at the bottom if your patient is at high risk or not. So this was just a quick example, but there are several resources on this app. The next app is PDQuickCalc. This app is a great resource for providing dosing references and calculating medications that you'll prescribe children in your clinical setting. This app also includes growth charts and the vaccine schedule and other resources and references that you may use. This next app may look very familiar, as many of us have used this app while in school and during clinical. Bates Pocket Guide and Physical Exam is a great app to use to assist in your assessments and physical exam. Many apps will provide this information, but this app seems to be a little bit more detailed and gives other references as well as visual illustrations. If you have to refer back to this textbook quite a bit, then I think getting this app would definitely be worth the investment. The next app is Medibable. Hopefully I'm pronouncing that correct. But this app allows you to translate and communicate with your patients that might speak a different language. This app is geared towards medical questions, so it's easy to use while you are conducting a visit with a patient. The app is set up to allow the patient to provide short responses to your questions. For example, a patient can respond back with a yes or no response. They can write or say a number, color, or response, and they can point and give gestures to the questions that you ask.
¿Es alérgico a algún medicamento?
Spanish and other languages are available to download. The final app that I want to share with you is the Visual Diagnosis app. If you work in dermatology or work in urgent care or primary care, then this app is a must-have. This app will help you determine the patient's skin disorder based off their history, certain characteristics of the rash, and other symptoms the patient might be having. This is definitely one of my favorite apps, and I do love that it provides so many different pictures and illustrations and visuals to help you determine your diagnosis. There are so many more apps out there, but I wanted to share with you some of my favorite. Stay tuned for my next video as I talk about other resources you can use, and thanks again for watching.